Hello, everybody. Dr. Lonnie Stewart here from the Healthcare Education Transformation Podcast. Are you a physical therapy student about to start studying for the National Physical Therapy Examination? Or maybe you're a professor, or program director, or clinical instructor who teaches DPT students preparing for the NPTE? Either way, we would recommend checking out our sponsor, NPTE Final Frontier, and the community they've built around preparing for and succeeding on the NPTE. That exam and the preparation that goes along with it can be long, tedious, difficult, and stress inducing, but it doesn't have to be. NPTE Final Frontier has the tactics and resources to help address all of the usual barriers. They even have scholarships to help with NPTE study courses, FSBPT registration fees, and even research opportunities. And if that's not enough, they're even donating to the very first annual HET Podcast Scholarship to be awarded at the end of every year. Go to npteff.com for all of the details and use code HET for 10% off all purchases. Links to both the NPTE Final Frontier and their scholarship options are available in the show notes. And now, let's get ready to learn.
Hello, everybody. Dr. F. Scott Feil here with a special episode of the Healthcare Education Transformation Podcast. This is just a little bit of an update of what we have coming down the pipeline for you guys. So, the HET podcast has been an evolution over the last several years of basically two guys who had rough goes at it when it came to academics and DPT school, and really just an exploration of talking to the experts about how healthcare education's kind of broken and how we can possibly fix it. We've worked a lot with breaking down silos and trying to find best practices with regards to healthcare education. We've talked to other healthcare education providers. We've talked to doctors, dentists, nurses, OTs, speech language pathologists, PAs, NPs, the list goes on and on. And in doing that, we've learned a lot, which was kind of the whole point of the podcast, right? It's been our mission to really learn and see if there's better ways to teach some of the things that we teach with regards to healthcare. It has been an absolutely amazing journey, and we'd like to try to keep that growing. We have some big plans for the next couple months. You'll start to see a bunch of things rolling out, a bunch of resources, a bunch of things that people have kind of asked us about a lot over the years. And now we're finally coming into our own as far as becoming experts and authority in those things. And so we're trying to help people with regards to teaching and learning and really just trying to be the best possible lifelong learner they can be. That being said, we are about to release our first ever Teach Me Something Tuesday journal. This is basically a workbook that goes through all of the Teach Me Something Tuesday episodes from last year so that you can kind of listen to them and then go back into the journal and take, your takeaway points from that episode that week and then how you plan to implement those into your teaching and learning. It's about 50 to 52 episodes last year. I think it was probably in the 50 range. This year coming up, there will be 52 with maybe a couple of bonus episodes, just depending. So it's meant to be taken as like one lesson a week. If you want, you can do more. Obviously, you can plow through all 50 episodes in one sitting if you really wanted to. They're pretty short, digestible. But it's really meant to be used as a workbook that helps you listen to the lesson, reflect on it, and then go back and kind of think about how you would implement it in your everyday use, whether it's as a student studying and learning, whether it's as a professor teaching and learning, or whether it's just a healthcare provider and clinician just trying to figure out how to best teach their patients or how to best teach their students. We hope that that will be a helpful resource for you. We also have a course coming out in the very near future on how to get a job in PTA academia. So if you're looking to transition from clinical work to possible education, and PTA programs seem something that are viable to you because there's one or two nearby you, or you just seem to like the field of PTA work, this course is for you. We are also working on the sister course to that, and that is how to get a job in DPT academia. And now for a quick shout out to our newest sponsor, Varela Financial. If you're a physical therapist and you have student loan debt, you got to talk to these guys. What makes them unique is that they view financial planning like running hurdles on a track. And for PTs, the first hurdle many of us run into is student loan debt. Varela Financial will help you get over that hurdle. They not only take the time to explain to you which plans you individually qualify for and how those plans work, but they also take the time to show you what your individual case looks like mapped out within each option. So, if you're looking for help on your student loan debt or any area of personal finances, we recommend working with them. I use Varela Financial personally, and they were able to help me lower my student loan repayment from about $1,800 a month down to about $135 per month simply by finding the right repayment plan that best fit me, my family, and our life goals. You can check them out at varelafinancial.com. Link is in the show notes if you need it for reference, and tell them the HET podcast crew sent you. And now back to the show. So, if you're looking to make that transition again from clinical work to academic work and you want to get a job in academia, we've put together a course on how to optimize your chances of doing that. Because at the end of the day, it is competitive. It is a tough spot. There's only, I don't know, close to 300 programs in the nation at present. They are growing, so that's a good thing. But at the end of the day, 300 universities times about 10 core faculty really only gives you what, 3,000 jobs in that niche. It could be something that is the right place, right time. It could be something that happens due to your network. It could be something that you're just a really great fit for. But our goal is to tell our stories and our journeys of how this all kind of began and how we got into academia and some of the tips, tricks, and pointers we've learned along the way from people who have been program directors, people who have been new faculty, people who have been old faculty, and just things they wish they knew when they were coming up. And then once you get the job, what to expect and how to succeed at that. Obviously, a lot of us are all still trying to figure that out. So we give you the best advice that we have on it, and we hope that those courses will be helpful for you. And then last but not least, we have our book on leadership that is coming out as soon as all of the chapters are completed. And basically that's an avenue that we felt needed to be addressed post COVID for sure. And that's just making better leaders in healthcare. We want you to know that we all feel that we've gotten to the point that we are leaders and we, have different strategies and different approaches to leadership and that you too can be a leader. There are ways to get better at it and to practice it. And in doing so, we hope to tell our stories through leadership and through our different styles of leadership in hopes that it can be kind of used as a reference type book if need be, but really more of a self help book, right? And a self improvement book, right? A learning and development book for leaders. So keep an eye open for all of those. There'll be announcements on social media for that and the website. Hopefully, if there's any other resources that you guys feel like you need, or there's any guests that you'd like to hear from or topics you would like covered, please reach out to us at HET on all the socials and HETpodcast at gmail.com for the email, or just reach out to any of the hosts. We'd love to hear from you. We love to hear feedback. We'd love for you to subscribe to the podcast and leave ratings and reviews because that does help us. Obviously, rankings are a thing, so that helps. If you can do that and leave ratings and reviews, tell us what you like, tell us what you'd still like to hear. And hopefully, like I said, we'll have all these resources out to you as soon as possible so that if it's something that you're considering, if you're into healthcare education and you just want to dabble in it a little, dip your toes, see if it's worth it, that's definitely a good strategy. And we hope that the courses will help you kind of do that and find your own path. And again, optimize the best possibility for you to get a job in academia if that's something you're interested in. So hope these are helpful. Looking forward to hearing from you guys. Like I said, please subscribe, leave a rating, leave a review. And yeah, just let us know what you'd like to hear about on social media. We're there for you. We'd love for you to start interacting with us a little and telling us more what you want to hear about. And we look forward to seeing you guys in the next episode. Well, I hope that episode was entertaining as much as it was informational and educational. If you enjoyed this episode or any of our past episodes, we ask you to please subscribe to the podcast and leave us a rating and review. And please share out the episodes to those who you feel may be able to benefit from them. We also urge you to follow us on all social media platforms at HET Podcast and let us know what topics or experts you would like to hear from in future episodes. And just as a reminder, none of the information on today's show should be considered medical advice. It's simply infotainment or edutainment to help educate our audience. For medical advice, we always advise you to reach out to your preferred medical professionals, and we'll see you on the next show.